Down at the bottom, click on the Referrals tab, and you'll see up at the top you have 3 tabs. The first one highlighted is the inbound, and it sets the provider as the self-referral by default. You can't make any changes here, but what you want to do is click Clear and then enter in the correct referring provider. Click on the ellipsis button. If the referring provider is entered into the system, double-click. If not, click the Add New button, and then go ahead and enter in the referring provider's information and click Save, and it'll populate here. Double-click. Next, click in the reason box, and then type in the reason for the referral. Set the creation date. Maximum authorized visits we'll say is 10. Say the maximum charge amount will be $2,000, and then the pre-authorization code. Set your expiration date. Now the visits used and amount used you can keep track yourself. It might be easier if you use the recalculate button. And this is how it works. Anytime you post a charge to the visit, it'll actually, when you click on the recalculation button, update these 2 fields here. But you need to make sure that you post the charge according to the procedure code that you have listed here. And then while we're here, we'll also set our diagnosis codes. To set the status of the referral, you can click on the status ellipsis button, and let's say the referral was approved. We'll double click, and then select the facility that this referral will be treated at. Additionally, you have an Add Note button down here. When you click on it, you can type in the notes and click OK. It'll automatically pull the notes in here. Now once a note is created, you can't delete it. Next, let's go ahead and work on our outbound referrals. We'll click on the outbound tab, and then the doctor that we're sending this patient to, we'll click on the ellipsis button and then double click on one of the doctors. Again, if a doctor isn't listed, you can always add. Like the screen before, you'll pretty much type in the information, maximum authorized visits, and maximum amount. Some diagnosis codes here. And when you're done, be sure to click Save, because if you don't save, you won't be able to do the next step, which is the print fax. This is nice that when you send the patient over to Bruce Jones here, you can take a piece of paper with them with all this information. By clicking on the print fax button, there's a couple of things we can do here, the least of which is selecting Advanced MD's referral template up here in the left-hand corner. When you click on it, you can see down below that they have some headings and information that they typed in. And in addition, they have what's called merge fields. That's pulling bits of information from the patient, including the name, date of birth, etc. We can scroll down and take a look at the form in full and find out if we don't like the template. We can do one of 2 things. We can either go ahead and modify Advanced MD's referral template or create our own. To do either of which, click on the Templates button. We're looking over here and we're looking for the referral type. Select it. It pulls up Advanced MD's default referral. Either delete, type in our own. In any case, when you're done making changes here, you can click Save. For example, you see these fields down here below for merge fields. That's pulling the patient's full name and the patient's date of birth. Let's say we don't want to pull in the patient's date of birth, but instead, we'll delete it. We want to pull in the responsible party's date of birth. Well, what we can do is over here on the right hand side, look for merge fields by expanding the folders, scrolling down, and there's the date of birth under responsible party. Double click and it adds the responsible party date of birth, and the R here is for responsible. In any case, make your changes like I said and click Save. For me, I'm going to clear it and create my own referral form. Now for my template here, I'm going to select Referrals so it pulls up in the referral screen anytime I click on the Print Fax button on the Referrals tab in the Patient Demographics. And then below, I'll start typing in my referral template. Dear. Then over here I want the referring provider's name, so I expand the referring provider folder, and let's say I want the full name. Double click on the provider full name, it adds the merge field, hit enter, and remember you always want spaces between your merge fields. So for example, if I had 2 merge fields here, make sure there's a space. If they're touching, you're going to get some funny looking results. I'm referring. Now I can go ahead and pull up the patient's name. Let's do full name. What's the maximum charge? Again, we're looking at the referring provider. There's the maximum charge merge field, which will pull that information from the referring provider tab. And then the pre-authorization number, which is the pre-authorization code. And finally, we'll close it off. Sincerely, the doctor. So we'll expand the providers folder to the doctor's full name. So long story short, what's going to happen is that when we save this template and we go on to the outbound tab of the referrals tab and we click the print fax, we'll get our template to pull our information up instead of using AdvancedMD's default referral. Click Save. We'll close. Now we have the referral template here that we can choose from. Dear Jones, Bruce Jones, I'm referring Carrie Heffernan to you with a maximum charge of $3,000. Pre-authorization number is, and if it was there, it would show up. So let's take a look. I'm going to go ahead and scroll down, and we're referring this to Dr. Jones, so it's the outbound. There's Dr. Jones. Bradley Rice is her provider, and the maximum charge is at $3,000. There it is. I don't have an authorization code, but if I did have one there, it would pull in the merge field, and if it's not there, it's blank. In any case, click Print, hand this off to the patient, and say when you go see Dr. Jones, hand this to him, so he can go ahead and enter that into his system. The last tab, Marketing, is used to allow the office to track and analyze marketing efforts per patient from marketing referral sources, such as when I click on the ellipsis button, I have a few here like another referring provider. Now if you do double click on the referring provider, let me move this out of the way, it'll populate in the description the referring provider if it was an inbound. For example, this was already referred by Dr. Jones. If I go ahead and double click on referring provider, Dr. Jones pulls up, or at least his last name. Clear those and either select one of these or add our own. If I type in the word postcard, I've already had it in the system and I deleted it, and when I click Save, it'll ask me, do I want to retrieve something that I previously deleted? I'll say yes. And then go ahead and close, double click on the postcard, and then type any descriptions in. Now, if the source hasn't come in yet, you can go ahead and see what your status is by clicking the ellipsis button with things like, I just sent out the postcard on this patient. And then when they come in, if it did work the postcard, click on the source and say it was the postcard. Maybe it wasn't the postcard, maybe it was actually a patient. In any case, be sure to save your work when you're finished. And then you'll see after you click Save, it'll add the information down below. Click Clear and keep track of future marketing efforts.